The patient is placed in prone position on the operating table. A lateral image is taken to identify the angle and orientation of the pelvis. Slight Ferguson angle can be added to C-arm angle for a direct view into the joint plane if needed. An AP shot is taken to identify the anatomy of the joint. Adjust the C-arm to approximately 20 to 30 degrees oblique angle, showing a direct view into the plane of the SI joint. Add Ferguson if necessary. Place a guide wire over the joint and mark its location on the skin. Place a guide wire over the superior portion of the joint and mark it on the skin. Place a guide wire over the inferior portion of the joint and mark it on the skin. Mark the center of the joint on the skin. The superior incision point is 1 cm superior and 0.5 cm medial to the superior section of the joint. The center incision point is approximate to the center of the joint and 1 cm medial. The inferior incision point is 1 cm inferior and 0.5 cm lateral to the inferior section of the joint. Insert the superior guide wire with the medial lateral angle matching that of the C-arm, 20 to 30 degrees oblique, and the superior inferior angle at 45 degrees superior. For the insertion of the inferior guide wire, adjust the C-arm to 0 degrees oblique and approximately 20 degrees Ferguson. Insert the inferior guide wire with the medial lateral angle at approximately 15 degrees lateral and the superior inferior angle at 45 degrees inferior. Once the tip of the guide wire engages the joint, let the angle of the guide wire follow the anatomy of the joint. For insertion of the center guide wire, adjust the C-arm to 20 to 30 degrees oblique and 0 degrees Ferguson. Insert the center guide wire with the medial lateral angle matching that of the C-arm, approximately 20 to 30 degrees oblique, and the superior inferior angle perpendicular to the patient. Adjust the C-arm to a lateral view. It will remain here for the rest of the procedure. With the guide wires inserted, you can see the inferior and superior implants are placed at a 90-degree angle from one another. The center implant is 45 degrees from the inferior and the superior implants. The implants are intended to be inserted in a specific order to minimize the overall distraction of the joint. First, the superior implant. Second, the inferior implant. And last, the center implant. Utilize a long-bladed scalpel to dissect tissue alongside the guide wire for direct visualization of the joint space. Slide the joint locator over the guide wire and into the joint. Ensure the notched portion of the instrument is lateral to the patient. Verify the joint locator is in the joint plane by attempting to twist. If resistance is felt, you're in the joint space. Confirm with lateral image. With the notched portion lateral to the patient, slide the cannula over the joint locator and into the joint space. Place the tapping cap over the instrument assembly and lightly impact with a mallet to seat the cannula on the sacrum. A noticeable change in the tone of impaction will be heard when the cannula comes into contact with the sacrum. Attempt to twist cannula. If resistance is felt, you are in the joint space. Confirm with lateral image. Remove joint locator and guide wire from the instrument assembly. After removal, lightly impact the cannula to ensure it is not migrated. Insert the drill guide into the cannula with the off-centered hole medial to the patient. Insert the drill bit into the off-centered hole and slide down until it hits the sacrum. To ensure the cannula has remained seated, verify the drill bit slides all the way into the drill guide and stops at the depth marking etched on the drill bit. Beginning with the off-centered hole, drill both of the holes in the drill guide. Ensure positive stop is reached when drilling. Remove the drill guide from the cannula, rotate 180 degrees and reinsert. Beginning with the off-centered hole, drill out the 2 holes in the drill guide. Remove the drill guide from the cannula. Place preferred bone growth promoter into the cannula and insert using the implant tamp. Insert the SiJoin implant into the cannula with the marked end down. Impact with the implant tamp until positive stop rests on cannula. Remove the implant tamp. Insert the remaining bone growth promoter into the cannula and place using the implant tamp. To avoid dislodging the implant, remove the instrument assembly carefully by pulling straight out of the joint space. Verify the implant is in the proper orientation using direct visualization of the joint space. Duplicate the procedure for all implants.